Well, good morning, afternoon, evening, everyone, and welcome to this session on brain health and COVID. I'm Victor Zhao, the President of the National Academy of Medicine. It's my pleasure to moderate this session of distinguished speakers. So, we're talking about two of the most important health issues facing the planet today, COVID and brain health. First, brain health. It's a huge problem. Mental illness is the #1 cause of adult disability globally. Estimated 450 million people worldwide live with a mental illness. 1 in 4 people will be affected by mental or neurological disorders. Estimated 12 billion working days are lost due to mental illness every year. So it costs the global economy over $3 trillion US. Furthermore, mental health is linked to chronic disease. Majority of people with mental illness have physical illness such as diabetes, hypertension, heart disease. So the other issue, of course, is COVID, devastating pandemic, and the resulting economic downturn and COVID itself have negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. A large study of more than 60,000 people published in Lancet Psychiatry last week found that people with COVID experience a first psychiatric illness at roughly twice the rate of those without. But a more surprising finding was that people with brain health disorder experience significantly high rates of COVID infection than those without, even controlling after for other health and demographic characteristics. Now, given the enormity of this issue, it's vital to identify solutions. That's why we're here. We bring people together, experts, in this conversation today. There's so much we do not know about the connection between COVID and brain health, but this is one of the reasons I'm proud to be a co-founder and co-chair of the board of the Healthy Brain Global Initiative, a very exciting initiative aiming to mobilize $10 billion US for brain health research. My co-founder, co-chair, good friend, Garen Staglin will say a few words about HBGI later in the program. So I'd like now to turn the science connection between COVID and brain health. To discuss this, I'm so pleased to introduce our first speaker, Dr. Shekhar Saxena. Shekhar is the co-chair of the Healthy Brains Global Initiative's work stream on use of proceeds. He is a psychiatrist by training, professor of practice of global health, mental health at the Department of Global Health and Population at Harvard's Chan School of Public Health. He's authored more than 300 academic papers and served as director of Department of Mental Health and Substance Use at the WHO from 2010 to 2018. So Shekhar, you have the floor.
Thank you very much, Victor, and good morning, good afternoon, good evening to all the participants. I'm very pleased to join this panel today on the first day of the WISH Summit. I have attended all the WISH Summits, and it's such a pleasure to join again. And on a topic that is extremely important, a topic that was important always, but it's even more important now. And as Victor explained, brain health and mental health are things that we all need to be paying more attention to on what we can do and also what we need to know further. And HPGI fulfills both of these objectives in a nice way. But before we go to that, I would like to explain some of the things that we are witnessing. In fact, all of us, you and I, are witnessing for our mental health and brain health during the current crises much more than earlier. And I would like to explain it with the help of a few slides. I'm requesting my colleague Toby to kindly share my slides. I have not been able to share it on my screen, but if I can get those, that will be very helpful. As the slides come on, I would just like to explain the first principle, that is that health is well-being. physical, mental, and social well-being, and they're all connected to each other. I worked for WHO for 20 years, and WHO's definition of health includes physical, mental, and social well-being. And at this point of time, we are having an assault on our physical well-being, mental well-being, and also on social well-being. And they are all three of them are connected. So that's exactly the kind of situation that we are facing right now. I'm again going to give it a try to share my screen, if I can. Can you see my screen, Victor?
No, I cannot.
Okay, I will just go on that, and even if I don't have the slides, I can explain in a few minutes the things that I want to talk about. The second principle I want to explain. Yes,
we can see your slides now.
Yes.
Yeah.
Can you go to the third slide, please?
Okay, this is Garen. I'm doing it.
Okay, thank you, Garen, for assisting me.
Yeah.
The second issue I wanted to explain is right on this slide, that mental health has to be seen as a dimension and not as a binary. It's not about some people who have a mental disorder and others are being all right. We are all on this dimension somewhere. We might have a positive mental health, we might have mental distress, we may have a mental disorder, and we may have a psychosocial disability. And in fact, over time, we move on this spectrum from one to other side.
Shekhar, what slide should we be looking at? What slide number?
The third slide, mental health as a dimension, which is what I can see on the screen.
Good. Garen, can you advance that? I don't see it.
Yeah, he's on it. We're seeing it, Victor.
Yeah.
That's good. Thank you.
So during times of humanitarian crisis, like right now, pandemic is a humanitarian crisis, we all move on that dimension from left to right. If we were able to cope well, we are not able to cope so well now. If we had a mental distress, we can go into mental disorder. And if we had a disorder, we have more psychosocial disability. So we all move on that dimension. And this is exactly what we are seeing right now. If I can have the next slide, Garen. This slide, which is actually prepared by Garen's One Mind, just explains that there are many mental health footprints of COVID-19. It's obviously the people who get infected, and some of them, unfortunately, are having serious illness and dying. But there is, in blue, the second wave, which is about mental and psychological well-being, which actually have a much more persistent effect and much more larger effect. So not only that we are seeing it now, we will see much more of that in the coming times. And this wave might actually have a larger impact than many other things that we are obviously seeing as a part of COVID. Garen, next slide, please, which explains that socio-demographic and socio-economic impacts are the most impactful for this kind of pandemic disease. Things like people are losing jobs, people have less income, people have to look after the dependents, they are confined to home, they have to maintain what is erroneously called social distancing. It actually should be called physical distancing, because we need physical distancing, but much more social connectedness. And all of these factors are giving rise to a very large impact on our psychological and emotional health and on our mental health and well-being. The next slide explains that some of the things are some of the people are much more vulnerable. People who have a low income, people who are migrant workers, for example, in many large Asian countries, people who are in institutions like prisons and other institutions, including mental institutions, people who are experiencing domestic violence, abuse, who are prone to suicide, elderly, frontline workers, and people with mental health problems. These are all people who are vulnerable. That means they have a much higher chance of going into mental and brain issues. Next slide explains some of the things, some of the surveys that we are experiencing. I'm just giving example of one survey which was actually done in China on a very large population. Victor referred to a survey from US. This is from China. 52,000 subjects, 35% reported psychological distress, and a very large number of other surveys have also experienced similar issues. About 1/3 people are reporting psychological distress, and many of them have actually psychological and mental disorder, which can be diagnosed and which should be treated. The next slide just explains one issue which is very important: impact of social isolation and loneliness. This is a very recent report from National Academy of Sciences and explains that social connectedness is extremely important, and isolation and loneliness give rise to not only health problems, more disability, but actually kills people. So this is exactly what we are talking about. COVID is killing people because of infection, but also because of all the secondary issues like social isolation and mental distress. Next slide actually gives you a sum total of the socio-economic impact. UNDP has been monitoring the Human Development Index for a number of years, and for the first time, they are predicting that it will be in the red. You see all these blue bars. Even the global financial crisis gave rise to just a small decrease, but now for the first time in the history, we are going to see Human Development Index deep into red. And that's what worries a lot of people, that this impact will be there for a long time. Next slide explains that the economic cost is also high. Two of my collaborators in Harvard have actually suggested that this virus is a 16 trillion virus, and that is just for the US. And you see there in between, the mental health impairment is responsible for a fair amount of that cost, 1.5 trillion cost because of this. So it has put impact on mental health, it has impact on disability, it also has impact on our economies. And the next slide, I will summarize the issues that we need to tackle. One is that we need to take action now. The knowledge that we already have, we need to implement it. We need to seriously increase the mental health services that are available, but also we need to gather more knowledge, which is what HBGI is about. And we have identified 5 priorities on brain and mental health related to COVID-19, which need to be tackled urgently. Just to give example, it's about efficacy of digital and telephonic mental health therapies, which are being practiced so much now, but we need more research on that. Adaptation of psychosocial interventions, validity of large-scale youth telehealth, because youth are much more impacted. And also some basic science and translational science like mechanism of nervous system damage, which has been documented, but we need more research on that. And also on what could be the neurological impact of the COVID infection itself over a period of time, which we are discovering now, it could be quite substantial. Victor, these are some of the basic issues that we're struggling with, but I pass it back to you and we'll be happy to answer questions. Thank you.
Shekhar, thank you for an outstanding talk. This is really helpful to set the stage. You've asked a lot of very important questions, which I'm sure we'll discuss at the Q&A period. Now I'd like to introduce our next speaker, Dr. Nahim Dalao. Dr. Nahim Dalao is a member of also the HBGI Interim Board of Directors. He's a psychiatrist by training, the public health chairperson of the Zambia Medical Association, and a member of the Global Shaper community of the World Economic Forum. Dr. Dalao is devoted to leading grassroots to system-level dialogue on global mental health, particularly in response to the COVID-19 pandemic, through his work with Africa, WHO, UNICEF, BBC Africa, First Aid Africa, and many other global organizations. Nahim, the floor is yours.
Thank you so much, Victor, and thank you so much, Professor Shekhar. A warm welcome to everyone. My name is Nahim Dalao, and I'm a psychiatrist here in Lusaka, Zambia. I'll be taking you through the basic understanding of the impact of COVID-19 on brain health, in particular in low and middle income resource countries. Now, the question is there a rise in mental illness due to COVID-19 on the African continent or the other low resource settings globally? As you've heard, Victor as well as Professor Shekhar have already mentioned that there are studies and surveys that are coming out, and this is what I'll take you through a slide presentation. But before I go to my slide presentation, I would like to mention that there are a couple of things that have been affected directly in my practice. In my practice here at the leading tertiary hospital, which is at the University Teaching Hospitals in Lusaka, Zambia, in the capital, we've had many barriers due to COVID-19. We reported our very first cases in early March, and since then, a couple of things have happened directly at the hospital, in neurological as well as psychiatric departments. First of all, the preventive public health measures led to people initially not being allowed to come to hospital, and outpatient clinics were suspended. This led to a disruption in their service delivery. Further to that, the second point is mental health staff were relocated to other departments to offer COVID-19 relief, which just showed that they didn't take COVID-19 as something that should have affected mental health. But as per the previous speaker, you understand that there are a lot of factors with respect to brain health that should be taken into account. One of the points that was mentioned earlier on, and one of the things that is coming out, is telehealth. But telehealth in a country like Zambia and majority of African continents is proving to be difficult due to digital poverty. Further to that, the fourth point, which is stigma and fear of coming to the hospital due to COVID-19. This further hindered the concern from people to actually come and get care with respect to brain health, and in particular, mental illnesses. And finally, the lockdown measures. The lockdown measures that we had the lockdown measures that we had was to do with erratic supply. Now, I want to give you a context. Zambia is a landlocked country. We're surrounded by 9 other countries. We didn't have to lock down. All the other countries locked down, and because of that, there was an erratic supply of essential medication and further markup of prices of available drugs, which overwhelmed the system. All of these actually affected mental health delivery. I'm also finding it very difficult to share my slides, and my camera keeps turning off, so I'll just talk through my presentation. Okay. Now, talking about the effect of COVID-19 on brain health on the African continent. One of the things that has happened is the conversation with respect to brain health and cultural beliefs has been a difficult point to note on the African continent in particular. Talking about alcohol-based hand sanitizer, for instance, many of the local people easily thought of alcohol as something that we drink, which can be used to further wash your hands. So the point about socio-economic factors also comes into play. The perceptions and biases with respect to health determinants has to be further communicated to the local populations in local languages. As if that was not enough, at the borders of Zambia, at the borders of Angola, what happened was we have methylated spirit, right, which is used in the hospitals. It's a disinfectant. Other people, because alcohol became very expensive, the alcohol that we used to drink in our social habit, a lot of people started using methylated spirit to quench their alcohol withdrawal. This further perpetuated all the factors that came into play with respect to alcohol withdrawal symptoms. Now, I would like to share a statistic with you. The very first week, the very first lockdown measures that Zambia implemented were closing down bars, right? And because bars were closed down, a lot of people could not get access to their usual social habits of drinking. In that week, the very first day, I recorded in my practice a total of 45 delirium tremens. Now, ladies and gentlemen, delirium tremens is a medical emergency. If not treated well, adequately leads to mortality. And in that first week, we lost 7 patients to delirium tremens due to alcohol withdrawal. The question then follows to say, in as much as we're talking about alcohol withdrawal, we also need to talk about the consequences, the socio-economic consequences and social determinants of health and other deaths that are occurring due to the ripple effect of COVID-19. I will also talk about another vulnerable population that Professor Shekhar mentioned. These are the children. Because schools were closed down, a lot of children were at home. And due to a lot of other factors, children are currently being mistreated, maltreated within their homes. A report that has just recently come out from Save the Children Zambia is that for every 3 hours, one child is being molested in the communities. These are questions that we need to start talking about with respect to the socio-economic and social determinants of health in COVID-19. Another thing that I will mention with respect to the effects, before COVID-19, we know that the global burden of diseases is as high as 14% when it comes to brain health. But then 75% of that is found in low socioeconomic as well as middle income countries. And the current evidence and implementation science that we're using in practice is 1, impractical, 2, ineffective, and 3, very resource intensive for it to succeed in countries like mine in Zambia. Further to that, just last month, World Health Organization produced a survey from 130 countries on the impact of COVID-19 on mental, neurological, and substance use services. Out of that survey, it was found that initially 89% of the countries mentioned that they have incorporated mental neurological support in their COVID-19 response. But when further surveyed, it was found that out of that 89%, only 17% had the funding to actually incorporate mental well-being. So there is a 63% gap. The survey from the World Health Organization also showed that when it came to surveillance and research, only half of the 130 countries are collecting mental and neurological data in people with COVID-19. And further to that, when it comes to researching COVID-19 effects on brain health, out of those 130 countries, only 1 out of 10 of those countries are actually looking into the effects of COVID-19 on brain health. Now, this, I would like to let all our listeners know that did you know that out of all those countries, only developed countries are currently carrying out surveillance and research. Again, before COVID-19, one of the things that came out from Lancet Psychiatry was understanding the pyramid, the model of service delivery and treatment in mental and brain health. Turns out when it comes to basic psychosocial support, COVID-19 has promoted that. A lot of grants are being serviced with respect to basic psychosocial support at the ground level. But then at the top of the pyramid, which is where service delivery in terms of treatment and professional care comes into play, which is where psychologists, clinical psychologists, psychiatrists, neurologists come in, we have a huge gap in developing countries as well as middle income countries. And COVID-19 is showing that we need to actually be sure that as we're looking at the pyramid, not just the base, but we also need to look at the top of the pyramid, which is the professionals. We need to start getting more doctors to specialize in psychiatry. We need more doctors to specialize in neurology. For instance, in Zambia, we have no Zambian trained neurologists. Just this last week, this is when we are going to have our first graduates. We need to start thinking about these things as well. Finally, talking about points that I would like to focus on with respect to developing countries and low-income countries, mental health literacy has to go with mental health services. We can't talk about one without the other because many people don't understand what brain health is. It is an organ in the body that actually goes through a pathology. And this is what we need to start talking about on the continent such as Africa, including Asia. Thank you.
Thank you. That's very powerful, Nahim. What a powerful talk. I've learned so much. But let me go to the last speaker, Karen Staglin, my good friend. He's going to tell you about HBGI that we all have mentioned. Karen is a visionary. He's the co-founder, along with me, the co-chair of the HBGI initiative. He's also founder and co-chair of One Mind, the nonprofit that has raised more than $380 million for brain health charities and research over the last 25 years. He spent 40 years starting and building companies in financial services and payment industry as a private equity investor and philanthropist. So, Garen, the floor is yours.
Thank you very much, Victor. Well, and thank to all of the organizers of this conference, and good morning, good afternoon, as everyone else has greeted us. So I'm just going to try to summarize here what we've all heard, which is first that mental health is the biggest unmet medical need in the world. I believe the answer is that closer to 1 billion people are affected in one way, shape, or form by these illnesses. Second, I think it's important for us all to understand that Shekhar pointed this out in the McKinsey Institute, one of our key collaborators, has said that more than any other disease, the lack of evidence-based treatments really requires the acceleration of research across the globe. You heard some numbers. Victor said that the economic and social burden is huge, and as Shekhar demonstrated, it's actually growing. Victor cited $3 trillion, but we actually know that by 2030, the projection is it's going to $6 trillion. And that represents approximately 4% of the GDP of many countries. And our investment in curing these problems is much less than 0.5%. So we're upside down relative to the investment. Hence, the Healthy Brains Global Initiative. As Victor cited, this is a $10 billion goal and objective of raising in new finance for new science and for new life trajectories, the funds necessary to bend this curve. Any amounts less than this and the current level of investment is inadequate for us to make a dent in these illnesses. We need a response of this size and scale. To do this, we've assembled an unprecedented global coalition. We have over 50 leading neuroscientists, policy leaders, and government research leaders. We've done a landscape of what is out there, and we are not going to duplicate, but we're going to build on the work that's already been done. We're going to focus, to begin with, on youth between the ages of 11 and 24, where the most illnesses of mental health originate, something like 70%. And finally, we're going to use an information commons to share data so that we will go faster together and we will leverage the investments of individual countries. And finally, I would say that an important distinction with us is that lived experience, people with lived experiences are in all aspects of our work at HBGI. They're on our board, Nahim is one of them, we have several others. They're also in all of our working groups. So the saying of nothing about us without us is done throughout the activities, etc. So I would hope you will all understand that we are launched. We have a full secretariat. We have a full board of directors, and we're marching towards a formal launch of HBGI, the Healthy Brains Global Initiative, in May of 2021 at the World Economic Forum in Lucerne. So I hope you will all please share my enthusiasm, our enthusiasm, and the need for HBGI with your colleagues, with your government officials, and others in our field. So, Victor, thank you very much for this opportunity. I'll turn it back to you.
Thank you indeed, Garen. So, 3 powerful presentations and lots of time, or not lots of time, but lots of questions. Why don't I begin by asking you some of this? So, Shekhar, I think the Lancet psychiatry paper says that people with COVID have more mental health disorders, but people with mental health disorders also have more COVID. Now, one can argue this may be a biologic link, but I think your point about social determinants makes me think that maybe the common denominator, because we know in US, the people who are more vulnerable are those who are people of color living in more low socioeconomic stratum of our country, doing jobs, etc. They are more exposed, if you will, to COVID infection. At the same time, this could well be, as you said, they are more vulnerable to mental health disorder. Do you think that's the connection, Shekhar?
Yes, Victor. In fact, both the points that you made are valid. There is a biological connection that the virus does go to the brain, and if there is already a brain disease, it is much more likely to become much worse. But by and large, the largest proportion of the impact is because of socio-economic and socio-demographic factors. We live, Victor, we live unfortunately in a very unequal society. And the inequities are actually increasing over a period of time in the majority of countries. And the COVID pandemic has brought it out in much more direct impact than earlier. So the people who are poor, the people who are marginalized in the society, racially minorities, Black people, people who are poor, people who live in very crowded homes and localities are much more likely to suffer the infection and also a greater damage because of the infection. So it is not a surprise that the Lancet Psychiatry article that you referred to talks about the two-way process. The people who have mental disorders are 4 to 6 times more prone for getting infected, and the people who are infected or their family and colleagues are much more likely to have a psychological impact, an emotional impact, and sometimes even a mental disorder. As I showed, 1/3 people are experiencing a significant psychological impact, and about 10% have a mental disorder. So we are talking about, as Garen was saying, hundreds of millions of people who are getting affected. This is a crisis which cannot be ignored anymore.
I totally agree with you. Nahim, you talk about telehealth and the difficulty having access to in Zambia and low-income countries. I know for sure in our country, telehealth for behavioral services has gone off the roof. The Medicare claims data show during this time of COVID, there's tremendous use in telehealth. And yet, as you said, there's difficulty accessing this in your country and others. What are the effective health communication mechanisms if you don't have telehealth? Is there any strategy with a proven track record? This comes from a question from Faraz Elmir.
Yes, so that's a very insightful point to raise, and this I often raise it when we talk about it because COVID-19 has brought about the virtual reality, the fact that we are all living online. Right now, you won't believe it, Victor. I'm sat with lights around me because I know I'm about to expect a power cut. We have up to 6 to 8 hours power cuts as well, even in the capital city on any average day. A lot of people in the rural places don't have access to the internet or even let alone the cell phones, right? So telehealth is a problem. Now, effective communication means it's to do with empowering community elders and community leaders. There are these systems in place where communities put their own leaders, and these are the people they trust. Even with certain alien concepts such as COVID-19, because a country like Zambia, where we've had HIV and TB ravaging us, and we've had so much mortality and trying to deal with this epidemic of HIV, we've also had to empower the local community leaders with the knowledge. And when we teach them, they go and they share and spread the message. When it comes from your own people, people are more receptive to get the knowledge as opposed to letting others coming in your community and telling you what to do. So an effective means, there's a lot of research out there that shows that if you empower people that are close to you, that you trust and that you care for, you will be more open to take that. With COVID-19, there are still silos of communities that can be empowered. And this is what we did as the Zambia Medical Association through my office as a public health chair. We couldn't go in high-density communities and tell them to wash your hands with soap and water because 1, they don't have water, 2, they can't afford soap. So we had to empower the community elders, and they are the ones that were taught, and they went with that message, and that's how people took up that message.
I see.
Yes.
Are you still able to bring community workers to the community given COVID lockdown? How do your community workers reach the elderly and being able to carry that message?
So you have to go to those communities because here's the thing, Victor, let's be practical about it. When you have a community with 80,000 people living in, their homes are as wide and the area is 2 by 4 meters, and there's 4 people living in that home, how do you tell them to practice physical distancing? How do you go about doing that? So you really have to look at behavioral psychology and also the needs that they have. when they're living on a daily wage, day-to-day earning, how are you going to tell them to stay at home when they don't have food to eat? You have to choose the vices that you have to share with them. So you really have to look at what they can and what they cannot do. So in that sense, you really have to tailor your health promotion to communities as well. Similarly with COVID-19 mental well-being, this is the evidence-based method.
Thank you. Garen, Shaker showed 6 different areas or ideas that HBGI can do in terms of COVID and mental health. How are you going to move those ideas forward?
Victor, thank you for that question. You know, as we begin the funding and projects for HBGI, we've prioritized the impact of COVID-19 on youth around the globe. We've actually done a landscape analysis of all the work that's out there and identified those areas that are yet to be funded. So our approach on this first phase of HBGI is to address the 6 projects that Shekhar put forward. And so we're now in the process of meeting with philanthropists and governments to actually coalesce the initial resources of funding to launch those first 6 projects. Some of them are going to have very near-term impacts, and we're assembling a team of scientists that will collaborate globally to address those issues. Our initial goal is to raise approximately $500 million to address those first 6 projects, and we're optimistic we'll be able to begin these efforts sometime in early 2021.
Thank you, Garen. That's very exciting. It's great work you're doing. So you talk about focusing on those young. There's a question from the audience that says, direct mortality associated with COVID is much higher among older people. And so there's still a lot of unknowns about brain health consequences of disease. How do you deal with the older population, certainly isolation, vulnerability, susceptibility, but also how about the young people? You talk about young people. Young people are taking disease less seriously. And so they may be exposing themselves to years or even lifetime of brain health problems if they're not careful. So can you or any of the 3 speakers talk about this? I'm talking about both older and younger. In other words, the older, what do we do about this? And younger, if they are not careful, they're going to get infected and they may long-term consequences on brain health.
Victor, anyone? I would like to make 2 points. One is that the impact is there in all population groups. The physical impact is much more in the older generation, but the psychological and social impact is much more on the younger people who are struggling with decreased income, job losses, and child and elder care. And almost all the surveys, including one that I have been involved in, shows that the psychological impact is much larger amongst the younger adults. Between the ages of 15 and 35 is the one which is affected the most. But the other point which has already also been raised in the question is, are there long-term brain consequences that we need to be mindful of? And there is increasing amount of research to say that the brain is one of the organs that is also involved by the infection and the resultant inflammation. And we need long-term studies. We need the kind of investment that Garen is talking about to actually identify the kind of long-term, even minimal brain damage which can affect our life, our productivity, our well-being. So all of that needs to be worked out.
Yeah. So Garen, I think in your projects, you can have long-term follow-up, particularly the younger people, to see the long-term consequences, right?
Yes, we intend to have what we're calling living labs, where we're actually going to create global cohorts where we'll track people over long periods of time. We're particularly interested in the early onset of psychosis, what we can do to intervene, prevent and extend, and then track those people along through so we can prevent a second relapse if they've had a first incident. But the whole concept of living labs as a learning healthcare network, and that will give us a ready-made cohort for clinical trials of new discoveries that we hope will come from HBGI, is an integral part of our efforts. And just to make the point, Victor, this is 20-year project. So the way we're going to structure the financing and the way we're going to structure our efforts, we understand these are not going to be easy and they will take time. So we're building the governance mechanisms and the data sharing mechanism to allow this to sustain over a long, long period of time.
Thank you. That's brilliant. There's a question from Maha El Ekorim. Forgive me for massacring your name. You say, is there any acknowledgement from the global political community for mental health and social vulnerabilities exacerbated by COVID? Would you say this has galvanized into formal political commitments anywhere? And if there hasn't been any, what would you say have been the biggest obstacle in gaining that kind of support to anyone?
I think I'll share this question with Shekhar. One of the things that I will say is from the World Health Organization survey, it's very clear that initially up to 89% said that they have incorporated brain health into their response, but only 17% have actually had the finances and the funding to go ahead with that. When it comes to political will, let's not forget that they also have the same beliefs, they also have the same stigma, and they also have the same bias towards brain health. So we really need to carry out the momentum in those spaces as well for them to buy in. And this is where HBGI comes in, and this is what we're doing.
Victor, I'll just add that there is acknowledgement, but not enough investment. That's exactly what we need.
And that's
so Garen, what would you do? Garen, with HBGI, $10 billion, you're going to talk to sovereign states and, investment, raise the money. Would you be able to use that as a political leverage to get more political commitments?
Yes, two things. First of all, UN Secretary Guterres has actually made a public statement to say that the response of COVID-19 must be dramatic investment by governments in brain health and mental health research. Building on that foundation, we will have these conversations. We can actually prove on a country-by-country basis the impact of curing these illnesses will have on the GDP of countries. And I will also be very pleased to announce that California, as the 5th largest economy in the world, has just passed a bond issue that will devote $1.5 billion over the next 15 years to brain health research. So this is the first major commitment of a government. It's a state government, but it's at 1.5 billion of the 5th largest economy. We will be collaborating with, and this will be our first large partner for HBGI. So we're quite enthused by this, Victor. So there is hope, and we're going to drive it forward.
Absolutely, onwards. Listen, thank all of you for really exciting discussion. The ideas, the passion, the commitment is palpable. So thank you, and certainly I wish HBGI the best because it will make a huge difference. So thank you all.
Thank you, Victor.
Thank you, Victor.
Thank you.